Hey guys, so here we have the hip flexor stretch. We are targeting the rectus femoris muscle, and we also activating the iliopsoas muscle, so we're trying to relieve some tension there before we activate, so this should stop the anterior tilting. The next one is the gluteus medius and maximus, which help with the internal external rotation of the hip. Therefore, we need to release some tension, which will then stop and potentially aid in the rehabilitation of an anterior tilt. The next technique is the gastrocnemius. We need to release some tension in the muscle because we'll be working on the plantar fascia, which is fascia underneath the ankle, therefore relieving tension. The plantar fascia is a fibrous band of tissue which is reaching from the heel to your toes. Therefore, we need to relieve some tension in the fascia because it helps with our wingers gait mechanism, which helps with our walking and gait. The stretch will relieve some tension in the hip flexor, and these hip flexors can be the iliopsoas, which is connected to the hip, or the rectus femoris, which is connected to the ASAS, which is the anterior inferior iliac spine. By activating the gluteus medius in a nice stable position using a resistance band, will activate the muscle and therefore encourage the repositioning of the hip. By working on gluteus medius and minimus in a nice linear position in a functional training, we are encouraging the hips to stay in a nice stable position, therefore limiting an anterior tilt. Now, this is called a monster walk. You have the band down towards your ankles and you take a nice slow step. By doing an isometric contraction, we are looking to contract the muscle without moving the joints. Therefore, this would take some pressure and some pain out there. By doing this, we are going to activate more of the muscle. We're going to fire the muscle before we start doing some eccentric work. By using eccentric work, we are looking to create stronger connective tissue, so ligaments and tendons in that area. We are also looking at greater muscle damage. We're trying to create more muscle damage, and we are trying to stop that anterior tilt to activate the muscles. We have plank variations to activate the abdominal muscles to counteract the work on the posterior chain that we have just done. So we need to make sure that we stop a potential posterior tilt by maintaining the strength in our core.